of slushy, when I like a social security program for healthcare, you think say it will solve that huge out-of-pocket expenditure we come rather than ordinary people in for pulling out their pockets for spending at hospitals?
Well, if managed well, I mean, it may. But again, we for realize, health insurance gets a lot of challenges. It's not as straightforward as it appears on paper. Maybe in Ghana for almost a decade, and then we get health insurance, and I see the struggles and where they go through, And this is a scheme where they begin years ago, way before I even go there, and up to now, there's still a struggle, One of the things that we been challenged the health insurance scheme are the fact that it will not be different from ways we see at the free healthcare now. Because in Ghana, for example, under the insurance scheme, they get specific medications, specific investigation, specific condition where the health insurance take care of.
Also, to cover everything?
Not at all.
So
not
at all. Still out-of-pocket expenditure at some level?
Definitely. That's one big challenge. And another challenge where, I've been seeing gets, the fact that payments of the monies, because health insurance means there has to be some payments of the service at some point. Somebody collects the money from the people going to the insurance, and the services has to be paid for. We will see problem we for provide the hospital with medications for provide them with consumables for provide them with reagents in the lab. It's very challenging. So you can get to some points where some hospital can say, look, we need to take insurance. Where you come here, you get for pay. Because the insurance is not working effectively. We are not receiving consumables, we are not receiving drugs, we are not receiving reagents for our labs. So we can't continue for sick. Health insurance, me, for example, will affect me personally, when I be doing my research work. Initially, one of the things I will look at for checking blood level, it was covered by insurance. Some don't get for the pay for them. Along the line, the hospital stop for taking insurance because the government nobody send the money on time. And the hospital need for buy their reagents. They need for buy things that they need. So if the hospital know they get, then things and they from the authorities, then it becomes a problem. So, that's why I envisage as well, because even with the free healthcare, we get so much challenge with the supply chain. Medication, they're on paper. For the get our hospitals, we don't have them. If you go to Connaught, you go to the government hospital all over the country, basic things and they were lacking. And if we don't get a robust system, I know I'll get the impression like say, we go begin, slushy today, then tomorrow the problem is solved. We will be surprised, because it might not be the case. So again, I continue to emphasize, just for clarify, Honorable Minister, say we'll get 1,000. We'll not get 1,000 doctors. We'll get less than 1,000. The 500 we are talking about here, that's waiting we'll get on government system, the public system. But then, in addition to that, to be mindful, so we'll get foreigners, we'll get expatriates where they come. We'll get Nigerians and Umis, we'll get other people, we'll get the Arabs, we'll get life care. So if you factor all in, they provide service as well to people, the figure goes above 100, but less than 1,000. So whether 1,000 or 500, the message is clear. We are grossly inadequate. We are grossly inadequate when it comes to, the health workforce. And the insurance, if managed well, as I say, it will make a difference. But it does not stop. Even if we remove all the challenges, I want to emphasize it does not stop there. It does not stop there. Human resource are the most important resource in healthcare delivery. And honestly, the challenge I get with that, the minister speaks very beautifully about the ambition them for create, medical schools or paramedical schools, for build more hospitals. Those are fantastic ideas, we will really like for it happen. But let's look at it practically. We get very few healthcare workers now, and for provide them with an enabling environment, for take care of them very well, it's a problem. So what happens when we have 5,000? What happens when we have 10,000 doctors? If taking care of 500 doctors is a problem, what happens? And building hospitals is a good idea, but
they also talk about forecasting needs and also finding resources on how to satisfy that need in the future.
Yes, that's what I'm saying. So over the past 10 years, successive governments have been struggling to take care of less than 500 doctors. But, so how are you going to convince doctors that, if the number increase, they are going to be taken care of? That's a genuine concern where doctors can get. Okay. And we also talk about postgraduate, training people. That's another interesting area as well, where I'd always stand out for talk about, for the past couple of years, we don't begin to do postgraduate at the country, with the trained specialists there now. But then one of the big challenges we will get, and what I find interesting, are that even when we don't begin training with doctors, okay, we get young colleagues we want for specialize, but they're not believing the system, which is understood because we are starting, so we cannot compare or compete with places like Nigeria or Ghana. They have been there for years. So everybody want for train, go and forget the best. So if myself want for train, I feel like my country not will give me what I want. A human for that one for going on some side we, in quotes better off than which we system gets. That's like normal human behavior. So I understand the doctors employed.
But with time, that
but the issue is if you get a system, okay, where young doctors they yearn for left your country and for go out for good train, okay, wait who for do as a system, as a health system, as a ministry. Now for find out why them people there want for left and go. And in my own estimation, the reason they want for left for, there are things that we governments can handle, honestly, if the commitment is there. But wait till we continue for seeing that governments, up to this point as I'm talking, we still send doctors and go out for go do programs them. We don't begin doing our country. So we get few doctors them, and the few we get, we send and go out, instead of looking into the employees, looking at why do they want to go and addressing those issues, we send and go out. And further shrink the already inadequate human resource force will get. So these are concerns. And building 5 hospitals is fantastic, of course, it's fantastic. Health infrastructure is key in providing service. But the point is, even with the limited infrastructure we get now, occupying this infrastructure with adequate number of health staff is a problem right now. Okay. It's a problem. So, these are things we have to look at critically, before we just, conclude and say in the next 1 year.